setting the stage for the digital platform is exactly the right place to be thinking right now, especially when we think of all of the types of data that we have available to us. And if one thing has really been highlighted that I'd like to make sure to get across in the next 15 or 20 minutes or so is that COVID has really highlighted the need for us to bring data together in ways that have been possible but not necessarily implemented over the last several years. So it's really put a pretty sharp focus on the need to bring together novel types of data to improve patient care. So our mission at Validic is to improve the quality of human life by building technology that makes personal data actionable. And I always find it important to level set on this mission because it's rooted in the mission is core to how we think about the world, which is we are every single day, every moment, creating data, information about our lives that could be relevant to our health, and especially for individuals who have chronic or acute conditions. Acute being such as COVID, chronic being things like diabetes, hypertension, et cetera. There are data that are available that people could be taking measurements on that need to be used by healthcare professionals in order to make health decisions. And a good example of that is actually right on this slide here. This is actually a photo of a gentleman named Steve with his wife Cheryl. And Steve is actually a Validic success story. 4 years ago, Steve was actually introduced to Validic through a pilot demonstration program that we were running in coordination with the ONC at HHS, as well as PCORI. And they were really looking to show how personal health data can improve the quality of patient care. And Steve had actually, at that point, had been living with type 2 diabetes for over a decade. It was uncontrolled. His A1C was about 9.5 or maybe a little higher. And he was really frustrated because he was using a glucose meter. He was trying to eat healthy, but his quality of life kept going down. And he was actually getting depressed, and his energy levels were extremely low to the point where he actually had to quit his full-time job because by middle of the afternoon, he was just wiped out and he literally physically could not stay awake. And so Steve he had been seeing an endocrinologist who, would take his A1C every quarter and say, Steve, I got another failing grade for you. Clearly you're not doing enough to manage your diabetes. And Steve was saying, well, help me. I have this glucose data. Can you help me analyze it? And the doctor says, I don't know what to do with that. I don't know your glucose monitor. I don't really know there's no paradigm for me to interpret the data. All I know is your A1C is telling you you're not doing enough. And so, Steve found a new physician. It actually happened to be at the health system that we were running this pilot demonstration on personal health data with. And so Steve got enrolled in the program, and immediately he said, I was an engaged patient day one because the glucose data that he had been tracking regularly, part of the program was to feed the data into the clinical workflow so that the care team could actually see the data and combine it with all of his other numbers in order to make sense of it. And in addition to the glucose data, there was also blood pressure, weight, physical activity, and nutrition information. So the short version of this success story is that a few weeks into the program, Steve had a conversation with one of the care managers who was noticing that Steve's glucose levels were spiking between 7 and 9 p.m. at night, but Steve wasn't logging any food. And after a conversation, she found out that he had been kind of munching on popcorn. Now it was, salt, no salt, butter-free, just plain popcorn. Steve thought it was healthy as corn. And, that was kind of his paradigm of nutrition, was like, this is no calories or low calories. It's, kind of a nothing food. But it turns out, the care manager said, I think that's probably what's spiking your glucose. So Steve cut that out, and within 30 days, his A1C dropped by 0.5 point. It was the first time he'd ever made a behavioral change that drove down his A1C that resulted in a health improvement. And from that point on, he was hooked, and he kept making little changes based on the data and that his physicians now had. And the conversations turned, instead from him not doing the things he needed to do and him trying to figure it out on his own, the conversation turned into his physicians and Steve working through the data and understanding what are the different changes he could make. And now 4 years later, Steve's hit his lifelong A1C goal of 6. He's lost over 50 pounds. He's an avid swimmer. He's an organic gardener. He's back to working full time. He's in amazing health. And so it just really goes to show you how getting data in front of clinicians in the right way to have the right kind of conversations and make the right decisions is really important. So if you'll advance the next slide here, the way we see the world is that personal health sensors will be ubiquitous in the next decade. And that's really being driven by healthcare consumerism and the prevalence of chronic disease. The challenge that we have, the challenge that we have is that health decisions are often made by care managers or physicians, other care teams, without the context of what's happening in our daily lives. Most of the clinical guidance comes from inside the four walls, so to speak, whether that's actual four walls or metaphorical four walls, whereas the vast majority of our lives happen, in the real world, where we're able to capture personal health data. So next slide. What our clients are looking to do is access personal health data broadly to improve health outcomes of members. And we're really solving a couple of big challenges here. When we speak with technology folks, CIOs, CTOs, we're thinking about the data. They're thinking, how do I access all of the disparate sources and combine this with everything else? Because we have data from, it's weight, it's blood pressure, it's glucose, it's continuous glucose, it's nutrition, it's activity, it's spirometry, it's pulse oximetry. There are all these different data types and data points and devices. How do we actually access that and bring it in and combine that with all of the other data we have available? So that's the technology challenge. Then we have the clinical challenge, which is physicians saying, I'm interested in seeing all of this data, but actually I don't want to see all the data. What I want to see is just the data that are important at the time that I need to see it. And so really that's what Validic set out to solve. And so what we do is we orchestrate personal health data to seamlessly deliver that information wherever it needs to go. And so we help to bring it into the clinical data systems in a way that technology folks can use the information to present it properly. And we also can work with clinicians to elevate the data that needs to be elevated at the time that they said they'd like to know about information. And so how we do that is that we built an intelligent personal health data platform that makes this data easy to use for healthcare. So if you see here, we have an access to a world of health data. We process alerts, and we have one simple point of access. Now, to walk through that a little bit more about what that means, step one is, next slide, Andrew, please. Thank you. So step one is we connect data from hundreds of sources. We connect with over 480 disparate sources today. These are, as I've mentioned, things like blood pressure, glucose, weight, CGM, smartwatches, pulse oximetry, thermometers, weight scales. Pretty much if it's objective information that's captured in someone's daily life, we view it as our purview to capture that. And that is whether it's data from the cloud, data direct from Bluetooth, direct from devices via Bluetooth, data from cellular devices. We can even capture data from legacy non-connected devices using a technology called VitalSnap that we invented, which basically uses the camera on the phone to, in real time, run OCR on the display of a non-connected device and turn that into a digital asset and deliver the data up. So we grab the data from all these disparate sources and combine it into a common ontology. And then as you'll see next, what we do is we actually process and deliver that information. And we have a full rules engine that can run alerts, and we can route based on the data that comes in. We can route data, we can send an SMS to a consumer, we can send a secure message to a care team, via the EMR, or we can, fire push service all of the data or just the alert stream into a clinical data repository, like an EMR. So we're really flexible in terms of how we're able to deliver the data and make sure it gets to where it needs to go. Thank you. So we also analyze and visualize the data so that care teams can monitor the health conditions in the clinical workflow. And this was something that came about because we recognized that, just having the data available was not quite enough. We really needed to get the data visualized in the clinical workflow in a way that brought everything together. So I'll give you an example of how we have done this in practice. But the important thing is that we have built best-in-class visualizations of the information that can live inside of the clinical workflow for care teams. If inside of an EMR instance like Epic, for example, as well as inside of a care management instance. In the case of like a Zio Mega or a Med Decision or something like that, we can run these solutions inside of existing care management workflows so that care teams can actually see the data while they're working with the patient in the right context. And then finally, we handle a lot of what I consider to be the messy work. So if you go to the next slide here, thanks. We automate the patient consent, the security, the privacy, and all the third-party updates, which is non-trivial. And it's a big challenge when you're thinking about a health data platform, especially something where the data is coming from people's devices and tablets or phones in the everyday world. This is something that's really important to us. We're right now going through the high trust process and should have that wrapped up this year. We're in the freeze period right now. For any of you who understand the high trust process, we're ISO 27001 certified, and we continually put a focus on how do we make our system secure and make sure that we're getting the right consent from all the individuals. And also, when the APIs and devices get updated and added all the time, and we have a whole team dedicated to making sure that we have the latest and greatest updates on our system available all the time, and adding new devices as they're needed. So thanks. So really, if you think about Validic, and then I'll transition into some examples here, what we've really built is the enterprise platform for personal health data. We work with some of the biggest names in healthcare. We feel very fortunate for that. Like I mentioned, we have over 480 connected devices, nearly 200 clients, and we have over 4.5 million connected lives on our platform every day. So we understand how to truly scale these solutions across an organization and across many consumers as they're using these devices in their daily lives. And so, sorry, if you go to the next slide here. What I want to talk about now is really the need for why we do, or I guess a need that has been highlighted by COVID for why the type of data that we capture is really needed. So physicians have always spent nights and weekends adding data to the EHR. And what has really struck me since COVID hit is that doctors need data, and doctors are used to working with data. And when we ramped up telehealth, we ramped up video visits in the midst of COVID, which was extremely needed, and I'm thrilled that we were able to ramp up video visits so fast. All of a sudden, physicians were missing a critical piece of care that they were used to using, which was data. And so, if you think about physicians, typically when they're seeing patients, the patient comes into the office, they step on the scale, they get their blood pressure checked, they get their temperature, they might run some labs. There are things that happen that help the physician understand sort of that point in time of how the patient is doing. And the opportunity that we have here with personal health data in the post-COVID world, as video visits I think are definitely going to be here to stay, is to start to marry up longitudinal personal health data with these point-in-time video visits to help to really paint a more complete picture of how patients are doing in their daily lives. And so one example of how this is, how in the sort of pre-COVID pandemic paradigm, how data has been managed is that there's a physician, actually the physician who worked with the gentleman named Steve, who I mentioned at the top. I'll call him Dr. T. And Dr. T sees type 1 and type 2 diabetics, and for his type 1 diabetics and some of his type 2s, he actually prescribes them a CGM. And for the continuous glucose monitors, the data doesn't come into his clinical workflow. And so the way that he manages his diabetic patients who are on CGMs is that he, when he prescribes the CGM, he says, hey, look, this CGM has a family sharing function or a caregiver sharing function in the app. Can you add my email address in the CGM app so that I can get access to this data? And then in the evenings, he'll go home and he'll pull up his computer and he'll log into the CGM website, and he'll see the data that his patients have been recording via their CGM. And then he'll pull up his work laptop with Epic, and he'll type patient notes in for each patient based on the data that he's seeing with the CGM. And that's how the data has been historically managed by a very forward-thinking endocrinologist, because there was no other way for him to get the data. And then contrast that with, or I guess another example of this is on the next slide. There's a physician, Dr. Aaron Neinstein, who about a year and a half ago wrote a really fantastic article in CNBC about how he thinks that within the next 5, 10, or within the next few years, I suppose 5 years or so, that a lot of us are going to be tracking our blood sugar, at least periodically, likely with CGM. And the reason is that he has noticed with his patients that there's just a lot of information and data that comes from these devices that people don't see. And so if you look at the graph here, what this is actually showing is Dr. Neinstein tells the story of a 7-year-old patient he had who's super engaged with his health. He was exercising regularly, eating healthy, taking his metformin regularly, but his A1C numbers were still higher than they would like. And Dr. Neinstein kept saying, listen, you need to watch what you're eating. It's probably dietary. I want you to track what you're eating. And the patient kept saying, I eat healthy. I'm telling you, I know how to eat healthy. This is just my body. It's not my food. And so Dr. Neinstein said, okay, great. What I'd like you to do is just wear a CGM for a week and see what happens. And so the patient put on I think it was a Freestyle Libre. And within a few days, as the patient was looking at his own data with no intervention from Dr. Neinstein at all, he was looking at his own data, and he saw spikes every single morning between 8 and 9 a.m. And the patient reached out to Dr. Neinstein and said, I see it. I see the spike. This correlates exactly with when I have my morning orange juice and banana. And so he cut out the morning orange juice and banana, and sure enough, his glucose levels normalized. So these data are critically important, and it's critically important that patients and physicians and care managers have the data in order to create a common language. And so one thing I'd like to share with you is a case example of how this can really work at scale. So the types of use cases that Validic really helps to power, one are sort of health incentive programs. And so we work with a lot of, especially health plans on this side, which is really to help engage members in healthy activities. These healthy activities are, often things like step tracking challenges, but we're starting to see more incentive programs related to disease management. And then on the disease management side, we work with a lot of care delivery organizations as well as health plans to deliver remote monitoring programs for patients with chronic illness. And we're actually powering the largest centralized RPM program in the country. So to talk a little bit about how these programs can work at scale, on the next slide here, Thank you. So the programs that we power, we have over 50,000 active patients with a large IDN. The patients enrolled in the program have either hypertension or diabetes. This is deployed in the Epic clinical workflow nationally across multiple regions. There are, for the patients enrolled in the program with hypertension, we're seeing a 12% systolic blood pressure drop in the first 45 days, really moving from stage 2 hypertension to normal range. For the diabetic patients, we're seeing a 15% glucose drop in 45 days and a A1C drop of almost a full point within about 2 months. So really, we're really seeing great control in the numbers. And this is a program that the way that we've rolled out this program is the data come from the devices and they are written, the discrete data is written into Epic, but then also there are visualizations and care programs that that the clinicians themselves have designed to run these programs. And so there are alerts and triggers and thresholds that that allow the clinicians to be much more effective. So for example, a common alert is if a patient hasn't recorded a reading in a 24-hour period, send an SMS to the patient, remind them they're in the program. If a patient hasn't recorded a reading in, say, 7 consecutive days, then send an SMS to the care team, or actually, sorry, not an SMS, send a secure message via the in-basket to the care team to let them know, hey, something's going on with this patient. So that's a really simple example of how to make sure that patients are getting notifications when they need to make sure they're staying engaged in the program, and then the clinical teams are alerted when there's a larger issue that they need to know. There's a ton of other alerts, including stacked alerts around the clinical data, but really the point is that it's baked into the clinical workflow. So there's no Validic app, so to speak, that the clinicians have to separately sign into. It's all inside of the Epic instances. And so what we found is that clinicians are far more effective. So 92% of the physicians say the program saves them time, helps them make better decisions. 88% of the physicians say the program saves them time. It eliminates manual data entry and other manual tasks, such as with Dr. T's example of him reading the data and then typing patient notes in. In this instance, if Dr. T were at this organization, he would be able to just have the data in the clinical workflow. One of the interesting things is that in this program was we saw a 63% call time decrease. So the average call time between patients and clinicians went from 15 minutes down to 5.5 minutes. And over half the patients in the program reported feeling more accountable to their own health. And finally, 3/4 of the patients are still recording readings twice a day after 90 days in the program. It's super sticky. And 3/4 of the patients also report feeling they're receiving better care when enrolled in the program. So really strong results. And I think that the best practices on the next slide here, thank you, for how to scale a program like this is to integrate personal health data and other information and the programs of care into the clinical workflow in a way that the care teams can see everything they need to see from one view. And that's something that we put a lot of work into doing to help make sure that there's a very simple view inside of the patient's record to see all this information. The next thing is, and this can be challenging, but there are partners that we have that can help with this, but provide IT support for participating patients and clinicians to ensure that if there are challenges, you have someone that the patient can call so that they don't get frustrated with the program and opt out. And then finally, you really have to allow customization down to the individual patient for them to be able to meet the program needs. So for example, our programs, if a patient is enrolled in a heart failure program, for example, clinicians can actually adjust when they want to be alerted based on an individual patient. So if they want to more tightly control blood pressure, or if they want to be a little bit more lenient on a different metric, they can be. And it's really up to the physician's discretion, understanding the patient's needs and how best to service that patient, sort of as to where you can put the thresholds and customize that. And so, in summary, for Validic, we are the only platform that connects personal health data from nearly 500 disparate sources. We integrate the data pretty much anywhere it needs to go, including directly into the clinical workflow. For our RPM programs, we can support full bring your own device or as well as curated devices support. We actually have partners who enable fulfillment and shipping and logistics and all of that if that's needed. We really allow organizations to lead with your care team and your protocols. We really feel like we are the technology enablement for your care teams to deliver virtual care. We take a platform first approach to how we capture data and how we enable remote monitoring. There is no sort of concept of like a Validic diabetes management program. There's the concept of we have all of the tools that you need to build these programs and leverage all of the existing assets that you have in your current system, both personnel as well as technology, and we can deploy that through our system. And then finally, we're proven at scale. So we power, like I mentioned, the largest remote monitoring program in the country, and we have over 4.5 million people on our platform every day.